Measles cases surge in the U.S. as Texas outbreak spreads. Key facts to know. Health officials in Texas are raising concerns as a measles outbreak continues to spread across the state with a rising number of confirmed cases. The Texas Department of State Health Services, DSHS, announced on Tuesday that a total of 24 measles cases have been identified in Gaines County over a 2-week period, marking a significant surge in infections. Outbreak details and affected communities. According to the latest update from state health officials, all confirmed cases are among unvaccinated residents of Gaines County, located in northwestern Texas. Alarmingly, 22 of the 24 reported cases involve children, underscoring the vulnerability of unvaccinated minors to the virus. So far, at least 9 individuals have required hospitalization due to complications from the disease. Given the highly contagious nature of measles, health authorities are warning that the outbreak is likely to extend beyond Gaines County, potentially affecting surrounding communities. On Tuesday, the Brownfield Independent School District confirmed via social media that the Texas Department of State Health Services had reported measles cases in Terry County. Officials warned that the outbreak is likely to continue to spread. Additionally, Lynn County reported 1 case of measles last week, signaling further expansion of the outbreak. The spread of the virus is not confined to Texas alone. The New Mexico Department of Health has also confirmed a case of measles in an unvaccinated teenager residing in Lea County, which directly borders Gaines County. Health officials urge vaccination amid rising cases. As the number of infections continues to grow, medical professionals are emphasizing the urgent need for vaccinations. It is important to get up to date on vaccinations now, especially if you or your children are not fully immunized for measles, stated Dr. Miranda Durham, Chief Medical Officer for the New Mexico Department of Health. Health experts stress that vaccinations remain the most effective defense against measles, a disease that had been declared eliminated in the United States in 2000 by the Centers for Disease Control and Prevention (CDC). Measles cases on the rise as vaccination rates decline. Despite past success in eliminating the virus, measles has made a troubling resurgence in recent years due to declining vaccination rates. The CDC reported that in 2024 alone, there were 285 confirmed cases of measles across 33 states. Alarmingly, 89% of last year's cases occurred in individuals who were either unvaccinated or whose vaccination status was unknown. As of February 6, 2025, the CDC had recorded 14 measles cases nationwide, signaling a potential upward trend. The agency also highlighted a concerning drop in childhood immunization rates, with vaccine coverage among kindergarten-age children falling below 93%. Specifically, the uptake rate for the measles, mumps, and rubella (MMR) vaccine stood at 92.7%, a percentage that falls short of the recommended threshold needed to maintain herd immunity. Understanding measles, symptoms, and transmission. Measles is an extremely contagious viral infection that spreads through respiratory droplets when an infected person coughs or sneezes. The virus can linger in the air for up to 2 hours, making exposure highly likely in confined spaces. According to the CDC, symptoms of measles typically appear 7 to 14 days after exposure to the virus. The initial signs often include high fever, which may spike to over 104 degrees Fahrenheit, persistent cough, runny nose, red, watery eyes, conjunctivitis. 2 to 3 days after symptoms begin, small white spots, known as Koplik spots, may develop inside the mouth. These are a hallmark of measles and help in early diagnosis. Within 3 to 5 days, a characteristic red rash begins to emerge, typically starting on the face and gradually spreading downward to the rest of the body. Public health response and next steps. Health authorities are working to contain the outbreak by identifying and monitoring those exposed to the virus, promoting vaccination efforts, and advising the public on preventive measures. Parents and caregivers are urged to ensure their children receive the MMR vaccine, which provides highly effective protection against measles and helps prevent further transmission of the virus. As measles cases continue to rise, particularly among unvaccinated populations, Health officials emphasize the importance of community-wide immunization efforts to curb the spread of the disease and prevent further outbreaks. The situation remains fluid, and updates from health authorities will be crucial in monitoring and responding to this developing public health concern.